On this channel, I almost exclusively bring you interviews with PAs and NPs, but not today. Today, I am going to be talking with a recruiter. Don't switch off of this video thinking that this has nothing to do with you. The reason I wanted to talk to this recruiter is I wanted to get her perspective of the PA and NP professions from somebody who has knowledge of what we do and knowledge of what employers are looking for, but who is a little bit of an outsider, who is not a PA or an NP, and who could kind of tell us objectively what employers are thinking. Hi, it's Michelle with the Medicine Couch. Thank you so much for joining me today. As always, please hit the like button if you like the video, hit subscribe, and share the video with colleagues and friends who may find it interesting. Now let's dive into this fascinating conversation about the PA and NP employment landscape.
My name is Madison. I am the owner and founder of Advanced Scope Talent. We are an APP-focused recruitment firm. I've enjoyed being able to help primarily orthopedic PAs and NPs, but we've also dabbled in other specialties. So we have clients within family medicine, primary care, within neuro or ortho adjacent type of stuff within pain management, and then kind of all across the board. So it's been fun because I've been able to learn a lot through all of it. I started in healthcare recruitment, went into tech, and then moved back into healthcare recruitment and started my business.
Do you think that employers look at us as very valuable and that we bring a lot or have a lot to offer to practices?
I think the answer to that is yes and no. When I go and I have what I call intake calls with new clients, a lot of times I'm asking them, okay, what is the structure of your practice or your department, right? So, how many physicians do you have? How many NPs or PAs do you have? Are the PAs competing for time with the residents? Like if it's a hospital, is it a teaching hospital? Are they getting OR time? If it's a private practice, are you utilizing them just in the clinic, or are they also first assist? And understanding and then hearing their responses to that. I think a lot of people only see PAs and NPs as like they cover clinic, right?
Yeah.
They cover the low paying stuff that then the surgeons can go and do the things that pay the big bills and get the bigger reimbursements. And there's something to be said for that, because collaboratively you can make that work where everyone does feel respected if there's bonuses based on performance and RVUs and all of that good stuff and first assist time. What I often find is that it's not that practices don't see the value in PAs or NPs. It's that they don't compensate or treat them or position them effectively in the bigger dynamic of the team, the collaboration of the team. And then I think that's why we have such an issue with high turnover, people leaving after a year and a half, people feeling like they weren't receiving the right training and just kind of being tossed to the wind saying, well, it's clinic, it's not that hard, so just go for it.
Almost like we're disposable entities.
Yeah. And I think we need to understand too with that, though, every year we're seeing the shortage of physicians and an increase in APPs. So if practices are smart, well, then they're leveraging the fact that, yes, PAs and NPs can cover some of that lower acuity stuff, but at the same time, you have to be able to compensate them fairly and make sure that they feel valued and that they do have growth opportunities, because they're not scribes and they're not glorified medical assistants. And I feel like that's a lot where I have to sometimes educate people on like, why aren't you doing it this way? Or why are they only able to be in the clinic? Why aren't they getting first assist time and et cetera? Or why do they just have a flat salary and they're not being compensated on the fact that they're billing pretty much the same things, right? And I think that's where there's a lot of miseducation, but I don't think it's because people don't see the value. I think it's just that historically speaking, it hasn't always been so.
Yeah, and reimbursement, I think, has changed throughout the years, for what
Yeah.
PAs and NPs get. And so some people aren't even aware of that. From the flip side, when you were working with PAs and NPs who were looking for placement, do you see us valuing ourselves or understanding what our value is? Or is it the same thing where we're just not educated as well on the value also?
Again, I think yes and no. There are sometimes I talk to people and they know like, hey, this is where I fit in the organization. And I always tell people advocating is not always standing outside of courthouses and state houses and federal government and saying, we want X, Y, and Z, but it's saying, hey, like, I understand that this is what I've been doing. I actually think that I can take on this. And I think that if we did this, it would actually help with profit for the clinic or with patient outcomes and satisfaction rates and being able to schedule easier and better. And also satisfaction of your providers and clinicians, because that's important and vital too. So many people are fleeing being patient facing and wanting to go in consultative roles or alternative options. And there's a way to mitigate that. And I think that's through people not being afraid to speak up when they're being underutilized or when they're being overutilized for the wrong thing.
I wonder, because all that sounds great, but it's always difficult when you're trying to
Yes.
get the job right and stuff, and you don't want to necessarily overstep, but you also don't know when is the right time to talk about
Mhm.
those kind of things. Do you think it's of value for PAs or NPs to have that conversation with the employer while they're still in the hiring process? Or do you think that's
Yeah.
something that should happen afterward?
No, 100% uncover the ugly up front. So if I'm the NP or the PA and you're in an interview, you say, we're both adults, this has to work. And if we want it to be a long-term fit, there are some things that are very important to me. And so I might ask some questions that seem off-putting, but it's really just me caring for the longevity of if this does work and you do want to bring me on the team, everybody's happy. And I can stay and you can get your ROI on me because everybody knows it's not like the second a PA walks in that their salary and overhead and everything else is just covered and they're making profit. So I think just calling it out for what it is and having those questions ready to go of like, how are your current PAs being utilized? And just letting them talk or tell me about the top PA in your practice. Why are they the top in your mind? There's red flags you can look out for. I could talk about that forever in terms of their responses or how they talk about them, right? But I think it's important to uncover the ugly up front and maybe just say that. Like, I'm trying to uncover the challenges and it doesn't scare me. It's not because that will make me turn and run the other way because no job is
Right.
perfect. But I've got my expectations as to what I want to do and what I know I can do for you, my
Yeah.
features, accomplishments, my benefits, my fab statement, and it's got to work with what you need too. Otherwise, you're both wasting each other's time and or wasting a position on a
Yeah.
resume and or having to pay the cost
Yeah.
of turnover on the client end. So that's where I always advocate for like just get it out on the table. And if
Yeah.
somebody's really that defensive about it, like that's a red flag because somebody
I
should be able to say, you know what? It's an urgent care clinic. It's really freaking busy all the time, and you are going to be working nonstop. And the standard is to see X amount of patients per X amount of time. And if you can't do that, then this is the repercussion of that. And then you, as the clinician, can say either that's for me or it's not.
But sometimes the problem with that is you never know when to ask the question because sometimes you don't even get to meet the physicians or other people in the
Right.
practice until you've gone through a couple interviews. So, like, is the office manager the person you bring this up with?
Oftentimes, office managers, they're fantastic, but they're office managers. Recruiting and talent acquisition is maybe 2% of their day, if that.
Right.
So they aren't doing 45-minute intake calls with the hiring manager and checking in with them week after week and understanding how the CMEs play in with overall time off and how the mentorship or training program is ramped based on performance based things and how that's going to be measured. I mean, they don't because it's not their job to, right? And if they do know that, then kudos to them. But I think that's few and far between. And that's
Right.
why I would advocate for saving the questions for when you are in front of the hiring manager directly, who's a clinician and or clinical in some way, shape, or form, or partnering with a recruiter who can get you that information out the gates so that you don't even
Right.
have to waste your time on an interview if it doesn't line up. If you're not working with a recruiter and you don't want to, I would say, hey, I actually really would love to talk to somebody that's a PA or an MP currently on the team. Could you set that up for me?
Yeah.
And could we do that as a first step? Because I'd really like to ask them some questions. And again, if somebody is super rigid about no, you can't, well, why not? Why are you so afraid for me to talk to
Right.
somebody on the team? You know,
Yeah.
like if you've got a good culture and you feel good about your retention and you feel like you're doing a good job as an employer or collaborating physician,
Yeah.
that should just be like, yeah, sure. No
Yeah.
problem. When
Yeah.
do you want to talk to them?
Well, you said that you could talk about red flags all day long, and I didn't kind of ask you this before the interview if we talking about, but
Yeah,
could you name just a few of the top red flags that you would advise people to look out for?
definitely. Yep. I think one of the red flags that I see is when I ask them, like, how are PAs and NPs collaboratively with the team? It's this sense of like they're just the order takers and they're not actually collaborating, right? Like they're seen as like the scribes or the medical assistants that are just handling low acuity stuff. They're never asked to do anything more. They're never seen as anything more. And they don't have privileges that they should, not because of legislation, but because the physician either doesn't trust them or the
Yeah.
practice model is just so that it keeps them at bay. And from a retention model, I think that's awful. But I think that a lot of people
Right.
prey on new grads with this
Well,
is,
before you move on, though, I want to say one quick
yeah,
thing about that because it made me think about this comment that I had read on some post somewhere. And I remember one of the doctors said, well, because they don't know how to manage a case as it evolves, as things get more complicated.
What?
Like, what
yeah.
are you talking about? I'm seeing the same acuity as the physicians
Mhm.
are. I work by myself. I'm not asking them all the time. If I have a question, I ask, but it's like,
Right.
it just floors me when you see that other people don't understand what a PA or an NP can
Yeah.
do and what our training is. And it's probably not that difficult to figure out, right? If you ask that kind of question, like,
Mhm.
how do you see us collaborating, and use their answer to gauge that.
I think it also varies. The physician, and that's a primary care physician, and what the primary care NP or PA might be doing, there's a smaller differential, I feel, than when
Right.
you look at a neurosurgeon
Hmm.
and somebody that's in post-op and pre-op and clinic for an outpatient neuro. So that's
Right.
where I just think it greatly depends on the specialty and the practice and the model. But I do agree that I think a lot of times it's a combination of the physicians not wanting to have them know as much
Yeah.
because they feel somehow that like PAs and NPs are going to take over, which it's like nobody's wanting to do that. They just want to have more
Yeah.
autonomy and they don't want to feel like micromanaged. And I think that PAs are also on the lower benchmark of that, even in consideration to NPs. I was talking to a COO at a large ortho firm, and he's like, there's just been more NPs in advocacy for it because there's more nurses in management than there have been historically PAs in leadership roles. So I think that there's more autonomy for NPs than there is for PAs. I think now we're seeing a trend where PAs are rising into leadership, but for a long time it was just you were a PA.
Yeah.
That's what
Yeah.
you did. Whereas nurses, they became nurse practitioners and then they managed units and they became chief nursing officers. And so they had a seat at the table long
Yeah.
before PAs did.
And you're saying that you see employers recognize that, or they're more comfortable with the fact that NPs could do other things, whereas they kind of sometimes put PAs in a box, like this is all
Yeah.
the PA can do. Is that kind of what you're saying?
Yeah, and I think that I see a lot more nurse practitioners move into leadership roles without advanced degrees within like healthcare leadership, like MHAs and MBAs, whereas I feel like a
Yeah.
lot of PAs have to go back to school to even have that conversation started.
I did a video on that recently, right? I mean, I talked to a PA who is in the C-suite in a big organization, and it was a hard row for her to get there. And she
Yeah.
talks about, the struggle. I'll put a card for that video
Yeah.
up there if somebody's interested in going to see that. But yeah, I mean, that was one of the things that I wanted to hear from you as far as what you're seeing out there as far as preference for PA and NP. And I know that it totally varies by
Yeah.
practice. It's really dependent on what the people who are hiring are used to, what they know of, the two
Yeah.
professions. But as a PA, sitting here looking at these laws being passed and looking at want ads, it
Yeah.
seems like you see a lot of positions that are NP only. And then if they're not NP only, then they're NP/PA. And once in a while, I'll see an ad that's PA only. Is that kind of what you're seeing? Do you see more jobs where people are open to just NPs, or am I just seeing some skewed data?
I think it largely depends on the specialty. So, from our standpoint, because we are working with a lot of surgical specialties, I actually see quite the opposite,
Oh, okay.
where I talk to people, hiring managers, and I'll say, okay, so NPs, PAs, what's your preference? And they'll tell me we want PAs because of the surgical training versus that of an NP, especially family nurse practitioners. And then I've also seen the opposite with some of my clients that are in the primary care space. They want FNPs because they have a nursing background and they've been bedside for longer and they've handled chronic conditions for a longer amount of time. It's a give or take, but I do think historically speaking, the NP is just a more familiar role for a lot of people. And I think that predominantly, especially in specialties where there isn't a surgical component, I think it is a cost savings at times.
Yeah, that's interesting because I thought that we were on par with each other pretty much as far as pay goes.
I don't know. I would say that I've seen higher pay with PAs, to be honest. But again, I'm in
Hmm.
surgical subspecialties, so different.
True. Yeah. That's comparing apples to oranges there.
Yeah. And then I've also had clients, and I end up actually not working with this client because I thought that's really not a justifiable reason. She told me, I only want an NP. And I said, okay, may I ask why? Well, I just don't like PAs. I said, clearly you had a PA that you didn't get along with. And she's like, yeah, he was a jerk. I just feel like all PAs are just, they're not as good. And I was like, well, I was like, if we want to look at the education, if we want to look at the
Yeah.
specialty that you're within, I don't think that's really justifiable. Like, what if we find
Yeah.
somebody that's a rock star and who's a great culture fit and who loves the purpose of what you're doing? I mean, I don't know.
I had an employer that did the opposite. She goes, yeah, I don't ever want to work with an NP again. And I mean, I understand, like you said, you can understand they must have had a bad experience or
Right.
something, but you surely can't really say the whole profession.
Yeah,
Everyone who's an
exactly.
NP sucks, or everyone who's a PA sucks. I mean, each
Yeah.
individual person is going to come with their own strengths and weaknesses.
Yeah.
And what about like the state laws with NPs getting independent practice laws passed in, I think, more than half the states now? Do you see that come into play very much, or is it still mostly just personal preference?
There's a lot of people because they know that they can have just a clinic stocked with NPs and see and churn and see more patients and bill more and make more money than if they had it with PAs. But
I guess I just don't understand why the volume would be any different because in reality, no one's like going in with us to see patients or sitting there for us to report to them. We just see patient after
well,
patient after
yeah.
patient too.
But if they can have like, for example, if they can have more NPs in one spot with one collaborating MD. So like here in Georgia, you
Oh,
have to
I
have
see what you're
one
saying.
physician.
Yeah.
So they can have more NPs
Yeah.
than they can have
Okay.
if they had a few PAs under. Yeah.
Okay.
So
So you're saying that they can have more because of the numbers that of how many
yes, yes,
they
yes.
can supervise. Gotcha. Okay. You know, PAs are working on it, but yeah, our lobby is not near as strong as the NP's lobby. Our numbers are not near
Yeah.
as high as far as how many we have and how much money we have to work with. So we're
Right.
kind of struggling behind, but that's kind of why I wanted to get your input is if you see us being pushed out of the job market, but it sounds like in talking to you right
No.
now where there's plenty of positions still open for
Yeah.
PAs, especially like you said, surgical or specialty type.
And I think APPs in general, like it's only going to grow in demand because of physician shortages as people retire. And I don't think that that's the right way to push for PAs and or NPs. It should be a balance. And I think that people should work collaboratively. You're working together to create the best outcomes. And it doesn't have to be this pitting against one another of who has autonomy and who's better and who's more educated. And I think just by so many physicians aging and that aging population, it is going to be interesting to see how that kind of levels out. And I hope it does.
Yeah, I do too. And I think it will eventually. And I just think the laws will lag behind and it'll be a while before we
Yeah.
get on kind of equal footing again with NPs. So about NPs, and
Mhm.
again, this is nothing disparaging against them, but
Yeah.
I know that is some concern with NPs going to like online schools, and I've heard some employers won't hire people go online. And I know, I have NPs that watch or people that want to become an NP. Have
Mhm.
you had seen any problem or pushback from employers with seeing an NP that's gone to an online school?
To be honest, because we are in more of a surgical role, I do see more of a push for PAs from my clients than I do
Yeah.
NPs. Now, I still do hire NPs and have clients that do want to hire NPs. I haven't had that situation. I will say this though, even with the PAs or the NPs, there are some schools that are looked to at a higher appreciation for the training that's offered than others. And so oftentimes, you send a resume of somebody that's gone to X, Y, and Z school, it holds a lot more weight. And I'm not just talking about people that are coming out of big name colleges, but just there's
Yeah.
some PA programs or NP programs that are stronger than others, and they're
Yeah.
more well known and they're more involved. And I do see a preference on that side of like, oh, they graduated from this program. I know they're
Yeah.
strong because they're well represented and they're involved in
Yeah.
AAPA or AANP, and their
Yeah.
professors also work over here. And I know a guy. So there is that.
So one question that I have that I know I see a lot of people ask, and that's if they take some time off, whether they're taking some time off to have a kid and they're out of the workforce for a couple of years, or if they get into a position that they just realize is not great, it's toxic, and they just want to get out, and they haven't worked there like a year yet. Do you have any thoughts on that? Because I know people are afraid to leave jobs because of that. Do you see that holding people back or something that employers really have a hard time with?
I do think it's always a question that comes up when there is a gap on a resume. And again, I think that's why having that middleman can be helpful because we're figuring out what that is, right? If I see a gap on a resume, I'm like, okay, just let me know what happened, right? And sometimes it's that guy was such a jerk. I was literally his assistant. Like, he didn't treat me right, or she, or whatever, the collaborating physician. And you get the story because a resume is a piece of paper. And that's what I like to tell people is when you know the value that you bring, the resume is not the whole story. And it's something that you submit on Indeed, on whatever job application, which again, gonna pitch using a recruiter who has a relationship, who can explain it and say, hey, look, I know this looks this way, but there's a valid reason for why. So that you're not just an office manager's looking at it and going, skip, next one,
Yeah.
right? And I don't think there's anything wrong with it. I think we're all human beings. I think we all have situations. I personally have had situations where a job just wasn't a good fit, right? Like I had a 6 month stint with a staffing agency that was, in my mind, doing things so ethically against my own values that I didn't want to be a part of it. I didn't care how much money I could make or how stable it was or how prestigious the name was. I didn't want that for myself. And if that makes me a job hopper for having that stint, well, then so be it, right? Because the
Yeah.
right employer is I'm going to say, this is what was happening. This is why I left, right?
Right.
And I don't speak ill on them, but it just wasn't for me. It didn't line up.
Right.
And that's okay. And then I think too, there are people that take time off for sabbaticals. I think Shane, or you might already know him. Yeah.
Yeah, I've already interviewed about sabbaticals.
Oh,
Yeah.
yes. So, perfect example of somebody that has taken sabbaticals continuously throughout his career. And
Yeah.
he's just open and honest about it. If somebody asks, what's
Yeah.
this gap? Oh, I went and traveled the world with my family. And here's what we
Yeah.
did. And if you're a human being on the other end, and again, here's where like if somebody has a problem with that, it's a red flag, right? Why
Right.
would you want to work for someone that's like, I don't think you need a sabbatical. You need to work 80 hours for the rest of your life. And it's like, no, I
Yeah.
value some other things and I really enjoyed that time and it helped me refresh and come back ready to take on this job. So I think I probably look at it a lot differently from others. I don't think it should hold anyone back. I think sometimes employers will let it. And I would
Yeah.
argue you just have to meet with the right people, and whether that's somebody that's currently working there and you get a referral in to have that conversation to explain, or a recruiter and or writing a cover letter explaining, here's why. Because I already know that you're going to look at it and probably toss it aside.
Yeah, I am in the camp. I firmly believe if you're someplace where you're miserable and it's not able to be
Yeah.
fixed, or you don't believe it be fixed, or you just cannot, you know, like you said, it
Hmm.
is totally misaligned with you and your beliefs,
Yeah.
leave the job. There are plenty of jobs out there.
It's worth it because at the end of the day, they're going to replace you.
Yeah,
And I can't stand when people are like, work is family. It's like, no, it's not. Like, they're
yeah.
going to replace you. Your family doesn't replace you. And I'm not going to be miserable for the sake of a resume.
It's amazing our thoughts on work. I listening to an audiobook called The Pathless Path. It's an amazing book. He points out some things we don't ever think about or even realize that we feel that way about work and that we take it as something that's a given
Right.
when it's not. It's a construct that was adopted, and now
Yeah.
80 years later or whatever, this is how we feel about work when it's not how it used to be. So I think it's fascinating, our perceptions on stuff. All right, I only let you get through one red flag before I jumped in there, but are there a couple more just really quick you could give us?
Yep. So I think one of the easiest ones is just how they title their PAs and NPs. I've called places before and I've said like, "Hey, are you hiring a physician assistant?" I saw it on Indeed. A physician assistant? Yes. What is that? Like a medical assistant? And this is their front desk. That's the number one problem, right? Is you call these places and the people that work for the practices do not even know what your role is. So that's one. Obviously, when you see physicians with an apostrophe assistant, when you go into the office for your interview, look at their plaques, like where they introduce their docs, and see if the PAs or NPs are on it or if it's just the doctors.
Yeah, that says their degrees are important, yours aren't. And, people don't need to know who you are. They just need to
Right.
know who we are.
So it's just those little things that when I have these conversations, I'm always looking out for those kind of red flags. Also, I mean, I think it's telling when you just ask questions of what's the best PA on your team? How are they incentivized? How long have they been there for? Is a great
Yeah.
one. Oh, they've been with us for 4 years. Oh, great. Just as a PA? Yep. Why aren't they a lead by now? Why aren't they training other people? How many other PAs do you have on your team? Oh, we've just got two. Well, how many physicians are there? 8. What? Oh, okay. Well, how many locations? Ah, there's 7 locations and there's 2 PAs. Like, so they're rotating between all those locations. I mean, it's just these things that I think people don't think to ask because they're just excited about breaking into that specialty or getting a job. And I would just say, like, ask those questions because all it's going to do is help you with job security and your peace of mind a year and a half from now, feeling like I'm where I'm supposed to be.
I feel like that good employers like it when people ask questions and try to
Mhm.
understand and show that they're trying to make sure that it's a good
Yeah.
fit.
And I would say too, like I have a client who is like the model employer. Like I think about how they've developed out their culture and he's just awesome. He's been on my podcast as well. And he actually told me one time, like feedback for a candidate, he was like, they just seemed too eager. Like I felt like they would just have
Uh,
taken anything. And so I'd also be mindful of like sometimes like you have to think you're talking to other clinicians. Sometimes they want you to be a little analytical and a little bit hesitant to discover like, okay, what's going on here, right? Like, what is this all about? And if you come across like a yes man or a yes girl or however you want to phrase it, and you're just, yep, yep, that sounds great, wonderful, yep, you're really not bringing any depth to the conversation. And so you're starting out in a kind of a position to be taken advantage of
sure.
rather than saying, here's my value and here's what I'd like to bring to the table.
Well, thank you so much, Madison, for taking your time to talk with us today. I'll put your LinkedIn information down below. Is that
Sure.
good? So
Yes.
people can find you. Thank you
Sure.
for sharing some of your insights and giving us a different perspective of looking at the PA and NP profession.
Definitely. It's been fun.
All right. Thank you. We'll talk to you later.
Of course.
Bye.
Bye.
I loved hearing her perspective on things. Now, if you're looking for a job, but you don't want to use a recruiter, I highly suggest doing some effective networking. If you're not quite sure how to network and want some pointers, then watch this video here. Thank you for watching. And as always, take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.